secondary bacterial lung infection, SBLI, is a serious complication in patients with H7N9 virus infection, and increases disease severity. The oropharyngeal (OP) microbiome helps prevent colonization of respiratory pathogens. We aim to investigate the OP microbiome of H7N9 patients without secondary bacterial pneumonia using 16S-RNA gene sequencing. OP swab samples were collected from 51 H7N9 patients, 21 with SBLI and 30 without, and 30 matched healthy controls, HCs, and used for comparative composition, diversity and richness analyses of microbial communities. Principal coordinates analysis successfully distinguished between the OP microbiomes of H7N9 patients and healthy subjects, and the OP microbiome diversity of patients with SBLI was significantly increased. There was significant dysbiosis of the OP microbiome in H7N9 patients, with an abundance of Leptotrichia, orobacterium, Streptococcus, Atopobium, Eubacterium, Solobacterium and Rothia species in patients with SBLI, and Filifactor, Megasphaera and Leptotrichia species in patients without SBLI, when compared with HCs. Importantly, Haemophilus and Bacteroides species were enriched in HCs. These findings revealed dysbiosis of the OP microbiota in H7N9 patients, and identified OP microbial risk indicators of SBLI, suggesting that the OP microbiome could provide novel and non-invasive diagnostic biomarkers for early microbiota-targeted prophylactic therapies for SBLI prevention. Introduction. During the avian influenza A, H7N9, epidemics of the last 3 years, 150 cases were confirmed in Zhi-gang province, China. One similar to the highly pathogenic H5N1 strain, H7N9 causes severe respiratory distress syndrome in most patients. However, because of clinical practice experience, findings from ongoing research and intensive care management, it has a lower case fatality rate than H5N1. Despite this, the incidence of secondary bacterial pneumonia, which is mainly caused by multi-drug-resistant Acinetobacter baumannii and Klebsiella pneumoniae, is much higher. 3 Secondary bacterial lung infection, SBLI, is a particularly serious complication of influenza infection. 4. 5 Current treatment strategies are based on routine culture-based diagnosis methods. Recent studies have highlighted the clinical significance of influenza-associated bacterial pneumonia, but most have focused directly on the host immune response, and have not examined changes in the human airway microbiota that lead to heightened susceptibility to subsequent pathogenic infections. When in equilibrium, the airway microbiome can restrict the growth of multiple invading pathogens. 6 Disruption of the microbial balance, which can result from acquisition of viral pathogens or through immunological perturbations, can have adverse consequences. These include pathogen overgrowth and dissemination, which can lead to symptomatic infections such as pneumonia. 7 Therefore, an urgent investigation of variations in the airway microbiota of H7N9 patients with and without SBLI is needed. Studying variations in the lung microbiota of H7N9 patients is challenging because lung microbiome sampling is an invasive surgical procedure that may cause harm to the subjects. The oropharynx is colonized by various important bacterial species, most of which are commensal and required to maintain the health of the airway. The oropharyngeal (OP) microbiome therefore serves as a gatekeeper of the airway, providing resistance against colonization by respiratory pathogens. Dysbiosis between regular residents of the OP microbiome is involved in pathogen overgrowth, and consequently lung disease. 8 Moreover, it is easily sampled, with minimal disturbance of the existing microbiome, and there is little risk or discomfort to participants. A more detailed understanding of significant variations in the OP microbiome in disease states and preclinical conditions may provide greater insight into the pathogenesis of pneumonia, and a better understanding of disease onset and progression. Herein, we characterized the OP microbiome of H7N9 patients with and without SBLI, along with healthy controls, HCs, using next-generation sequencing analysis of the bacterial 16S RNA gene. We aim to examine the association between dysbiosis of the OP microbiota and avian influenza A, H7N9, virus infection, and assess the susceptibility of these patients to SBLI during their hospitalization. We anticipate that these results will be helpful for early microbiota-targeted prophylactic therapies for SBLI in H7N9 patients.